Okay, Rosario, we can go ahead.
Okay.
Thank
Good
you.
morning for those who are in America, and good afternoon for those who are in other regions such as Europe, Africa, and others. And welcome to this fantastic event called 1 Billion Opportunities to Universal Access to Watch, organized by WaterAid, World Bank Group, UNICEF, SIDA, Special Olympics, HelpAge, and International Disability Alliance. This group has organized seminars on disability inclusive watch for the past 5 years and are working closely together to support the watch sector to improve access to watch for people with disabilities. My name is Rosario Galarza. I am the Intersectionalities Officer working for International Disability Alliance, and I will be pleased to be the moderator of this session. I would like to take this opportunity to go over some brief housekeeping rules. Please, if you are not presenting, if you are not a speaker, keep your camera off and microphone muted. Questions and comments are welcome in the chat box throughout the whole session. After presentations, we will have an open discussion segment in which we will call out some questions that were shared in the chat for our speakers to respond. Today's session, we will share examples of how organizations and governments can systematically include persons with disabilities in their work, how to influence and create inclusive watch policies, regulations, standards, partnerships, systematic monitoring, and tools. Before I turn to our first speaker, I'd like to briefly go over what we mean by inclusive watch. Inclusive watch is a process which addresses the barriers to accessing and using watch services faced by persons who are vulnerable to exclusion, including persons with disabilities. Inclusive watch means effective participation, accessible information which is relevant to the impairment, experience, and disability discrimination, accessible water points, latrines, and bathing shelters. Caregivers are supported to provide watch care, watch policies, and guidance documents include disability rights. And also service providers are supported to realize policy commitments. Progress and exclusion are monitored and reported on. And on this note, I'd like to introduce Penny Ines, who will provide a few opening remarks. Penny is the head of the Disability Inclusion and LGBT plus teams in the UK Forum Commonwealth and Development Office. She formerly led the Disability Inclusion team in the Department for International Development for 3 years. Her team has developed and published 2 ambitious disability inclusion strategies for the organization, implementing groundbreaking disability programming, and organized the first Global Disability Summit in July 2018. Well, Penny, the floor is yours.
Thank you, Rosario. Thank you for that introduction, and good morning, good afternoon, good evening, everyone. I just want to thank you for inviting me to this session, which is such an important one for the 1 billion people with disabilities worldwide. And I know that the WASH sector has done great work to provide inclusive access to people with disabilities, but that systematizing that is still a challenge. So I'm going to say a few words about the Fcdo's approach to disability inclusion, and then talk about how some of our work on inclusive WASH has put this into practice. So in February this year, we published a new disability inclusion and rights strategy for the UK Foreign, Commonwealth and Development Office, which sets out our vision and plans to achieve a more disability inclusive world by 2030. So yes, could you move to the next slide, please? So this is our theory of change for the strategy. And our vision, in a nutshell, is that people with disabilities will be engaged, and empowered to enjoy their rights and freedoms on an equal basis with others. So how will we do this? So by promoting the rights, voice, choice and visibility of people with disabilities. So firstly, we will defend the rights of people with disabilities under the UN Convention on the Rights of Persons with Disabilities. Secondly, we'll encourage their voice, because only people with disabilities know the barriers they face and how they can best be addressed. So they must be included in decision making, which is the key to nothing about us without us. Thirdly, we will create more choice for people with disabilities by making our policy and programming more inclusive. And fourthly, we'll increase the visibility through better data and evidence, because so often program implementers and policymakers think that they are reaching the most marginalized, and it's only when they check that they find that they are actually excluding people with disabilities. So rights, voice, choice and visibility are the outcomes of our strategy. And we also have a set of priority sectors, which you can see in the diagram. And our work on water, sanitation and hygiene sits within the global health sector, but also relates to climate action, which is an emerging area for us. So secondly, I'm going to talk a bit about how we're putting these principles into practice in our work on WASH. So could you show the next slide, please? Generally, the Fcdo is shifting from direct delivery of facilities to strengthening the systems that deliver WASH services. And we are including people with disabilities at all stages of the programme and policy cycle, building on examples of best practice, experience and learning from our collaboration with partners, including many people who are here today. So firstly, my first example is a voice and participation. So this is the top left picture. So AMREF in East Africa has worked closely with organisations representing people with disabilities to ensure that their needs were taken into account during the COVID-19 pandemic. They were consulted on hygiene and COVID-19 prevention messages and also infrastructure design, guidelines and training manuals. Because including excluded groups and making them a normal part of programme design reduces stigma. And one thing that really emerged as an important aspect of best practice from our programmes was the role of carers. And we found it was really important to acknowledge carers and intentionally include them in our activities. And this, of course, was particularly important during the pandemic, when not including carers put people with disabilities at additional risk. So secondly, engagement. We know that the way that we include people is really important. It has to be meaningful. For example, we learned from another WASH programme in partnership with UNICEF that training survey staff in how to ask questions is as important as asking the disability inclusion questions in our surveys, because the vocabulary they use and the attitude they present is really important. And a sensitive approach is really needed to overcome discrimination and stigma and to really understand people's specific needs. So the bottom left photo here is of Zafatia, a single mother of 2 with a disability. And through a sensitive and inclusive approach, her household's living conditions were improved with the help of her neighbours. And then, as I said, collecting data increases the visibility of people with disabilities. And here is an example from the Hygiene and Behaviour Change Coalition, which is a public-private partnership between Fcdo and Unilever and NGOs to help prevent COVID-19. And coalition partners were really encouraged to use a disability inclusion checklist from the outset of the intervention. And this checklist was based on the Washington Group questions, which reduced stigma by asking about impairment rather than a direct question on whether the recipient has a disability. So here in the top right is a photo of a young man being interviewed in his home. And so through that programme, data was collected on people's needs and barriers, which helps to identify their needs correctly, but also provides a feedback loop on whether the intervention is meeting the needs of people with disabilities. And then finally, our work on infrastructure has to be part of an inclusive system. And an example here is the construction of accessible and inclusive sanitation facilities in schools. And these cater to the specific needs of girls, mental needs of girls, female staff and teachers, and it can really make a difference to the attendance of girls and children with disabilities. So in Mozambique, Fcdo worked with partners so that inclusive principles contributed to setting norms and standards of national school designs that will be used for construction. So influencing systems like that will contribute to design in the future, it really embeds inclusion properly and helps to ensure that people with disabilities have more control and choice over their lives. And of course, a lot more needs to be done to make this a standard practice, but it's a start at least. So there are great challenges, not least the stigma and discrimination faced by people worldwide, but we have a lot of learning on accessible WASH, and we are determined to continue to fight for people with disabilities to enjoy their rights, to speak with a strong voice, have more control in their lives and be more visible. Thank you. Back to you, Rosario. I think you might be on mute, Rosario.
I'm sorry. I'm sorry. Thank you so much, Penny, for these wonderful words about inclusive and accessible water, especially including persons with disabilities and this universal right to have clean and accessible water for everyone. Now over to our first speaker, Jang Wilbur. Jang is an assistant professor at the International Center for Evidence in Disability, ICE at LSHTM, focusing on disability and water, sanitation and hygiene, WASH. She has extensive experience across East and Southern Africa, South Asia, and the Pacific Islands in designing and implementing inclusive WASH programs, research and evaluations, as well as disseminating research to influence policy and practice. She will be presenting about translating disability inclusive policies into practice lessons from Cambodia. Please, over to you, Jane.
Thank you so much, Rosario. Hello, everyone, and thank you for joining our session. So today I, along with the colleagues from Cambodia, will present our project called Translating Disability Inclusive WASH Policies into Practice, Lessons Learned from Cambodia and Bangladesh. And as Rosario explained, we're going to be sharing findings from Cambodia. So this project is funded by the Water for Women Fund through the Australian Department for Foreign Affairs and Trade, or DFAT. It's a collaborative study which was led by me. And in Cambodia, Rosin and Rat from WaterAid led the qualitative research with Vanda from the Cambodian Disabled Persons Organisation and Kanika, an independent consultant. Now, both Kanika and Vanda have a disability. So the study aims to help improve disability, inclusive and gender-sensitive WASH policymaking in low middle-income countries through policy and practice guidance for governments wishing to mainstream disability inclusive WASH at scale. So within this study, we conducted a policy analysis literature review to identify the inclusion of disability and gender in WASH policy and program documents from Bangladesh and Cambodia. That paper is published. Then we investigated how these policies were implemented and the WASH outcomes for women and men with disabilities and their caregivers in Cambodia and Bangladesh. We did this by conducting qualitative research in both countries. So now shifting to Cambodia, we focused on the Svai Ring and Kampang Nong Shnang provinces, and we selected 7 national and subnational government officials, 10 service providers, 16 women and men with disabilities, and 4 caregivers living in the 2 provinces to interview. And through analysis of the data, we identified key enablers and blockages for implementing disability inclusive WASH policies. We're currently developing guidance for government officials and service providers about how to deliver inclusive WASH at scale. Our study has been granted ethics approval from the London School of Hygiene and Tropical Medicine, the National Ethics Committee for Health Research in Cambodia, and the Bangladesh Medical Research Council. So now I'm going to hand over to the Cambodia team, who will present findings from the qualitative research and the recommendations for key stakeholders working on WASH in the country. And just to note, these recommendations were developed collaboratively with those stakeholders who also validated them. Thank you.
Thank you, Jane. It's very important what you mentioned about the Cambodia team and the recommendations for Bangladesh. Very important for us. Our next speaker is Eni Aitika Wektalima. Eni Aitika is a senior environmental health officer working with the Ministry of Health, United Republic of Tanzania, as the head of Water, Sanitation, and Hygiene Unit.
Sorry, Rosario.
I'm sorry.
I didn't mean to interrupt. We're going to play a
video. Okay. I'm so sorry because
no worries.
when you say thank you, I suppose that maybe you were point to put the video later, but it's okay. Don't worry.
Thank you. Apologies, we're having a bit of an issue playing it. I'm going to give it one more try.
Okay. Just to remind everybody that this event is possible through the collaboration of different partners here. Is HelpAge, International Disability Alliance, the World Bank Group, UNICEF, WaterAid, and the Swedish International Development Agency. And this is very important for us to have with these partners to do to make possible this event. Okay. Do we have the video now?
Apologies, I'm trying to share it. We should have it in a minute.
My name is Rosin from WaterAid Cambodia. Now I'm going to present the finding from key informant interview, people with disability, and caregiver living in Sweden and Kampong Chhnang province. Finding from key informant interview at national level, this ministry official think that disability is well covered within the WASH policy and plan. Inclusive WASH is a process which includes effective participation of persons with disability in research, policy, and practice, accessible and relevant information, accessible infrastructure, support to caregiver and disability is integrated in relevant WASH policy and guidance. Service providers are supported to realize this policy commitment, and these are monitored and evaluated with participation of people with disability. Organizations widely focus on ensuring accessible infrastructure. Remember that the focusing on accessible WASH facility was a priority in policy, include our policy analysis literature review. So the findings are triangulated. Most key informant only work with people who have mobility limitation. Very few mention caregiver. Again, this reflects what we found in our policy analysis literature review, where no reference was made to caregiver in policy document. WASH for all, without specific activity for person with disability, risk unintentional exclusion of this population. There is connection between the finding from national and subnational key informant interview. Ministry of Health thinking there is enough budget, and provincial government officials say there isn't, related to limited understanding of this cause of inclusive WASH, lack of understanding of disability, inadequate monitoring and accountability mechanism. Finding from organization of person with disability, OPD are paid for output, staffing and admin costs are not covered. Here is a quote from OPD. We have only bring problem for them to solve. We work without salary and we just read the problem. It is hopeless. In summary, this shows that people with disability, in this case OPD, are not facilitated to develop effective participate in policy planning meeting, meaning that disability issue might not be discussed or reflected in planning priority. Finding from people with disability access to bathing and toilet facility. Here is a quote from man who made his own reeling. So how beneficial adaptation can be? This must be provided in more organized and systematic way. Vanda, I will hand to you to continue more presentation.
Thank you so much, Barosin. My name is Vanda from Cambodian Disabled People Organization, Cambodia. I would like to conduct a presentation about the funding. Persons with disability do not want to offend as they want, especially those who are reliant on caregiver. It is difficult and time-consuming without assistive product. Next, please. Accessible facilities are unaffordable for poor households with persons with disability. Only 25% participants work formal or informal. Affordability and cost were a main challenge to accessible wash facility for persons with disability. Most participants saw they need accessible toilet and bathing facility, but they could not afford to build them. Next, please. About participation, our policy analysis lecturer review found that participation of persons with disability was the second most referred concept in a policy document and guardian. However, our primary research findings show that people with disability are not effective participating in their own development for variety of reasons. For instance, a lack of assistive device and inaccessible environment inhibit participation in WAS meeting. This issue also means that it was harder for caregiver to get the person with disability to a WAS meeting location. Inability to help to leave the home negatively affect the well-being of person with disability and their caregiver. Next, please. Gender different mean through health and hygiene. No caregiver or person with disability have been given any support or guardian on menstrual health and hygiene. One person with a hearing impairment was not even told about menstrual material. Almost half of participants did not leave the home when menstruating because difficult in changing menstrual material outside the home, mobility impairment, fear of getting a blood on clothes, mobility and intellectual impairment. I will pass to the Guru Kanika, please. Thank you.
Thank you, Vanda, for giving me a floor to continue the presentation. My name is Ngun Sukhet Kanika, an independent consultant. So, stigma and disability discrimination was highly prevalent. A person with disability cannot be viewed in silo to the context. Disability discrimination stigma in the age and health stigma is prevalent. This has a direct impact on the person agency. Disability discrimination must be addressed hand in hand with all service provision. Next, please. A gap is a lack of comments and that pain means caregiver have to handle fast and urine, which carry health implications. Without support and assistance, it is difficult for caregiver to provide care hygienically with dignity. Next, please. This role has physical health implications for caregiver because they do not have lifting device. Some caregivers spoke about dropping the person with disability, so this implication extends to the person with disability too. Next, please. Recommendation for government and implementer. This first is for policy, dialogue, and governor. Integrate disability within all WASH and health policy, include budget and KPI. Incorporate disability data disaggregation in planning, monitoring, and evaluation system using the WASH group set question, which are used in the Cambodia DHS 2014. Invest in improving WASH access in households that include people with disability. Recognize the vital role that caregivers often play in supporting people with disability with WASH-related tasks and assess WASH facility in policy. Include representatives from OPD and disability service providers in WASH coordination mechanism, and add disability as a standing agenda item to the provincial working group on WASH. WASH local OPD generate evidence about WASH experience of people with disability and caregiver at the household level. Develop effective partnership with OPD to understand the WASH related experience of people with disability and their caregiver, and improve their access to household WASH facility, understanding of disability rights, mechanism to demand WASH services and rights. Enhance the capacity of OPD and invest in their long-term sustainability. For implementation in community and household, promote comment, maintain journal, listing bells, provide specific information and guidance to caregivers about how to provide care with dignity and hygienically. Thank you.
Thank you. We are back for the next speaker. Over to you, Rosario. You might be on mute.
Okay, thank you so much for these important recommendations. Very, very insightful and inspired. Thank you, Jane. Our next speaker is Eni Aitika Wegitalima. Eni Aitika is a senior environmental health officer working with the Ministry of Health, United Republic of Tanzania, as the head of Water, Sanitation, and Hygiene unit. He has a vast experience on WASH for over 17 years and has a wide experience on formulation of policy guidelines and regulations on WASH. He will be presenting about applied inclusive WASH practices at the country level. Over to you, Eni Aitika.
Yeah, thank you very much for that wonderful introduction, and good afternoon, good morning, everyone, wherever you are. As I've been introduced, my name is Anyitike Maktarima from the United Republic of Tanzania. I'll be taking you through WASH inclusive initiatives in a case study of Tanzania. So next. I guess not everyone is aware where Tanzania is, but for those who are able to see, you can see the map of Africa, and you can see Tanzania. We call it the land of Kilimanjaro, Serengeti, and Zanzibar. We are bordered by Kenya, Uganda, DRC, Congo, Mozambique, and Zambia. Next. Yeah, in terms of the topic of the day, for us as Tanzania, there have been some forces which have pushed us to take a due consideration on the provision of adequate WASH facilities for people with disability. And one of it is the Sustainable Development Goals, the overarching policy that says that leave no one behind. So when you look at it, you see that the people with disability, they also need to enjoy the services from the improved WASH services. And our initiatives started a while ago, that in 2012, we started a big national campaign known as the National Sanitation Campaign, where among other things that were considered is the provision of WASH infrastructure for pupils with a disability, because before that, there was no separation of facilities for people with a disability. They were using the facilities which are used by other people. So you can just imagine someone who is crippled, polluted by other people. It was very disgusting. So in 2012, we started the National Sanitation Campaign for the purpose of actually improving sanitation as a whole, but also addressing the needs of people, especially people with a disability. Next. Next slide, please. Yes. Yeah, and from 2012, sorry, if you can go back. In that campaign, which started in 2012, and in a span of 5 years, we were able to reach around 2,100 primary schools, which were provided with improved toilets that had toilets separate for pupils with disabilities. And this actually has been an important landmark when addressing WASH requirement, particularly for pupils with disability, because after 2015, we entered into another phase where we aimed to reach more schools which are provided with the adequate WASH infrastructure. Next. Yeah, in terms of the policy, Tanzania developed its national policy on disability in 2004. And among other things, the policy emphasized on the formulation or amendment of the Act so that we have the regulations which take into consideration the needs of people with a disability. So after we developed the policy, then in 2010, we developed the Act or the registration. Next. Yes, this regulation is known as the Persons with Disabilities Act of 2010. Has been very helpful and instrumental in pushing the agenda for consideration of the needs of people with a disability. We have cited just two sections, Section 36 and Section 37. For example, in Section 37, it says that where service is provided by a public body, then the head of the body shall ensure that the service is also accessible to people with a disability. Now, the Act now is pushing us to make sure that when we are constructing WASH infrastructure, be it a toilet, be it hand washing or whatever, then we have to take into consideration the needs of each and every one. So we are now implementing this Act. Next. Next. We have also developed a guideline for WASH in healthcare facilities. It was in 2017 where we developed a guideline that give guidance on the provision of WASH infrastructure in healthcare facilities. So for now, all our healthcare facilities which are being constructed, the new ones, they must be provided with infrastructure that can save people with disability. And we are now finalizing the development of the third phase of the National Water Sector Development Program 2022-25. And in it, the aspect of inclusive wash has been duly considered. Next. And here is just an example of the designs that we have developed. This is a design for a toilet. It shows the provision of toilet for males and females. And in the middle, there is also a loom for people with disability. It's a big loom having all the facilities in it, a toilet, a hand washing, a big door, which can allow someone to move in with a wheelchair, a ramp that also has been provided. So we do it in all our healthcare facilities. Okay, so we make sure that at least, for example, for hospitals, we have 2 doors, one for males and one for females. These are specific for people with disabilities, but for the lower level services, including the dispensaries, we just provide for just one stance for both males and females. Next. Yeah, we have a program that is being supported by the World Bank, where we are trying to improve the access to water supply and sanitation, particularly in rural area. We are now working in 86 out of 137 rural districts in the country through the program known as Sustainable Rural Water Supply and Sanitation. And in it, from the designing stage, the aspects of the requirement for people with disabilities have been considered. So in every facility where we construct a toilet, there must be a provision for people with disability, be it in healthcare facilities or in a school. And we plan that by 2025, the program will be able to reach around 2,500 healthcare facilities, almost half of all healthcare facilities in rural areas, and around 1,500 rural primary schools. And in each of these institutions, improved wash facilities will be provided with the facilities for people with a disability. Next. Yeah, so far, in terms of the implementation of the rural water supply and the sanitation, in terms of the healthcare facilities, as I said, the target is to reach 2,500 healthcare facilities by 2025. But for now, we have reached 1,534. And in terms of the schools, the target is 1,500, but we have been able to go beyond it. We have now reached around 2,398 primary schools, almost 10% of all the primary schools in the country. Next. And all these have the facilities for people with disabilities. These are some examples of the picture of the construction work that we do. You can see a toilet for people with disability being provided with hand rails, spacious loom, okay, and the hand washing. You can see a ramp and a barusta, which are also provided to help someone walk easy to access the service. These are for the healthcare facilities. Next. And in terms of the primary schools, these are the facilities that we constructed for all the pupils. And also to the left, you can see a toilet for the pupils with a disability. There is hand rails there. There is a hand washing, and the room is big enough to allow them to move in with a wheelchair. Next. Yeah, we are working with the partners. We have a number of partners in the country whom we are working together. To mention just a few: UNICEF, WHO, USAID, SNV, and others. All these are working with the government, and to them we have issued instruction that whenever they are constructing wash infrastructure anyway, be it in a school, in a public area, or in healthcare facilities, they have to make sure that there is a provision for people with a disability. And so far, UNICEF, for example, has supported over 100 primary schools which have been provided with washing infrastructures specific for pupils with disability. And this is just an example of the construction work that has been supported through UNICEF. We have toilet, we have also wash, and these toilets have a provision for people with a disability. These are meant for healthcare facilities. Next. Yeah, in terms of the partnership, we do collaborate with the Federation of Disabled People's Association, with the acronym Shivawata, which is in the country. We work with them while developing the policies, the acts, the policy guidelines, and the tools. For example, the school wash guidelines and toolkits. The Shivawata participated from the word go to the final to make sure that the consideration for people with the disability is taken into consideration. So we are not working alone, but the representative from the Shivawata also do take part in the development of the Policies Act and the other issues. Next. Yeah, in terms of the perceived impact, based on what we have been doing, that is reduce the risk of disease transmission, especially to people with disability, because they now use their own toilet, which cleanliness can be easily maintained, unlike the previous where they used to share. And also there is increased dignity, okay, and also improved learning environment, especially for the pupils, that they are now enjoying the learning environment because their requirement on wash have been taken into consideration. And we also have some issues. Next slide. Yes, sorry. Yeah, thank you. We have some challenges. Everyone would like to see and enjoy the good thing that the current program is doing, especially to people with a disability, but we don't have enough resources to cover all the needs. So the demand is so high, both for healthcare facilities, but also for schools, but the resources are not that many. And we also have some challenges in tracking the progress on wash facilities at the household level. You have seen throughout my discussion, I've been talking about wash in the institution, the primary schools and also in healthcare facilities, but there is very little information regarding what's happening at household level. And so the bullet number 3 also emphasizes on the same challenge that very little has been done at household level in terms of advocacy and also in terms of development of designs which are specific for a household. In Tanzania, the construction of toilet at the household level is the responsibility of the household itself 100%. So it's difficult sometimes to construct a toilets just for ordinary people and also to construct also for people with special needs because of the issues like the cost implication and other stuff. Thank you for your attention, and I beg to submit. Thank you very much.
Thank you so much, Eni Aitika, for this wonderful presentation, for sharing with us these inclusive wash practices in Tanzania. And I would like to remind all the participants that you are invited to write your questions in the chat box located in the main event page on Pathable. Up next, we have a pre-recorded video from Ed Miller Lawford. He's an athlete in Special Olympics Mozambique, and Jose Shilovan, who is the senior project manager at WaterAid Mozambique since 2019. Ed Miller will share his personal experience on inclusive wash, while Jose will share examples tools from Mozambique used by persons with disabilities to ensure the development and implementation of inclusive wash services.
Apologies, I will play the video in a minute. I just need to switch screens. Thank you for your patience.
No, it's okay. Just to remind the participants, please, to use the chat box, and please write your questions to our fantastic speakers.
Hello, everyone. This is José Shilovan. I am Senior Project Manager at WaterAid Mozambique. My role is to oversee project implementation across the country program and also support with project design. We recently conducted an audit to accessibility and safety to the hand washing stations that we installed in different places. And this was done with collaboration between WaterAid, Special Olympics, and ADEMO. And we involved in this process Ed Miller, which is a Special Olympics athlete. And I will do a quick interview to Ed Miller to understand what was his experience during this audit. Bom dia, Ed Miller.
Bom dia.
Bom dia. Como é que está, Ed Miller?
Tudo bem.
Ótimo. Ed Miller, pode dizer-nos qual é que é o seu nome?
Edmilson Loford.
Ed Miller Loford. Obrigado. Ed Miller, o que é que costuma fazer nos seus tempos livres?
Gosto de tomar banho. Gosto de... Os pais mandam e mandar sair de casa. E gosto de ajudar os pais e comprar os compras. E gosto de cortar cabelo. E gosto de ficar bonito.
Gosta de ficar bonito. Ok. Muito obrigado, Ed Miller. Bom saber que gosta de ficar bonito e que gosta também de obedecer e de ajudar os pais. Isto é muito bom. Ed Miller, quando foi com aquela equipe para ir fazer a avaliação daqueles lavatórios de lavagem de mãos, o que é que fez lá? O que é que foi fazer?
Eu fui ver aquele tanque de água.
Os
Sim,
lavatórios.
Sim.
E o que é que fez lá?
Cheguei ali, pus meu pé e lavei as mãos.
Ok. Pôs o pé na água e lavou as mãos.
Sim.
Ok. E quem é que lhe ensinou a lavar as mãos?
Foi a professora.
Foi a professora. Ok, obrigado, obrigado. E conseguiu saber sozinho onde é que estava aquele lavatório ou alguém lhe levou para lá, para lhe indicar?
Alguém me levou para me ligar.
Alguém foi te indicar. Sozinho teria conseguido identificar o lavatório?
Não.
Não teria conseguido. Ok. E lá no local tinha algum sinal para sinalizar onde é que estava localizado o lavatório?
Não.
Não tinha, não tinha. E se tivesse algum sinal, havia de lhe ajudar a identificar o lavatório?
Sim.
Sim, havia de lhe ajudar. Ok, ok, bom. É bom saber ter este comentário seu. E foi difícil para si lavar as mãos ali no lavatório?
Não foi difícil.
Não foi difícil. Ok. Por que acha que não foi difícil? O que é que facilitou?
Eu estou pendendo de lavar as mãos.
Ok, ok. E diz que não foi difícil porque porque era só para pisar, não é? E saía
Sim.
água. Ok, ok, ok. E gostou da forma como a água sai para poder lavar as mãos?
Sim, gostei.
Gostou? Ok, ok. Tá bem, Edmila. Muito obrigado por
De
estas
nada.
respostas. É bom saber que foi uma boa experiência para si e,
Obrigado.
de fato, se tivermos sinais para poder identificar onde está localizado, vai ajudar a si e a todos a identificar.
Obrigado.
Obrigado, Edmila.
De nada.
So after the interview with Ed Miller, I will quickly present the results of the audit that we conducted in June, which was conducted in marketplaces, healthcare facilities, and bus terminals. I'll start by briefly presenting water rate, the context, and then the findings and recommendations. So water rate is present in Mozambique since 1995, and we've been working in the northern provinces of Niassa, Nampula, in the central province of Zambezia, and in the south provinces of Maputo and recently Gaza, with the mission of promoting universal access to wash services. And we have already benefited more than 1 million people across the country. During the COVID-19 pandemic, we developed a response plan. And based on that, we installed over 400 hand washing stations in 3 provinces, benefiting schools, communities, and bus terminals and healthcare facilities. And recently, we conducted the audit to the safety and accessibility of these hand washing stations in a collaboration with Special Olympics and ADEMO. And we find out with the audit that the design was overall considered to be very, very good because it takes into account the needs of people in wheelchairs and proved to be reasonably easy to use for people with intellectual disabilities, as Ed Miller was saying. In terms of location of the hand washing stations, we found out that most of them, particularly those installed in markets and bus terminals, are not accessible to people with disabilities. They're installed in uneven terrain and in some of places rocky terrains, which make it hard to access in a wheelchair. And there are no signs to indicate people where these facilities are located, which is particularly needed for people with intellectual disabilities, as Ed Miller recommended. Yeah, there are also some challenges in terms of the fact that there are no one near the hand washing station that can explain to people with intellectual disability on how to use these facilities. I have here some photos that illustrate the challenge that we have in terms of accessibility of the hand washing station to people with disability. Here you have a tap which is dedicated to people in wheelchairs that cannot be accessed because vendors occupied the place. Another photo that illustrates the challenges. In terms of recommendations, it was recommended that we have to engage an organization that represents people with disabilities so that they can advise on the design, but also operation of the facilities. We have to train caretakers on accessibility so that they can explain to people with physical and intellectual disability on how to use it. And we have to put signages across the location to indicate where these facilities are located. So another photo illustrating the audit and also the challenges. And this is all. Thank you all for your attention.
Thank you so much, Ed Miller and Jose. It's very important, this experience about how to know if WASH facilities are really inclusive and accessible for persons with disabilities from different constituencies. Well, last but not least, we will hear from BC Adverimi. BC is a water, sanitation, and hygiene WASH specialist with UNICEF New York, Make It Count guidance note on disability inclusive WASH program data collection, monitoring, and reporting. Please, BC, the floor is yours.
Yeah, thank you so much, Rosario, for the introduction, and good day, everybody. My name is BC Adverimi. I'm a water sanitation hygiene specialist. I'm the Global Water Disability Focal Point for UNICEF based in New York. Thanks so much. And I think what we want to do here is just to show some examples of guidance documents for disability inclusive WASH. And to showcase one of the ways UNICEF has been mainstreaming disability in its WASH programming. And as you all know, data is actually very important for planning, policy, and decision making. And to support UNICEF work on disability inclusive WASH programming, UNICEF has developed this guidance note, Make It Count, Disability Inclusive WASH program, data collection, monitoring, and reporting. And you ask me, why do we have to do this? And of course, the content is so clear. I mean, we've been talking about this issue of 1 billion persons with disability globally, and the challenges that are faced in accessing WASH services and facilities, which have been alluded to by a lot of presenters. But more importantly, persons with disabilities are often invisible in WASH data, monitoring, and reporting, and more likely to be overlooked in WASH policy and programs. These have been confirmed from the previous presentations. I mean, just to get to show the importance of this guidance for us, UNICEF. Why do we have to invest so much energy? It's just to make sure that we make the invisible feasible, and we make sure that we represent, we get data that will really enable us to do proper programming. Next slide, please. Why the guidance? I mean, as I said last, when you have a robust data system, is to identify persons with disabilities. With that, you're able to define the barriers to WASH and be able to monitor and report on result and impact on WASH on persons with disabilities. So data is extremely very important. Next slide. I mean, as I said earlier, persons with disabilities are often excluded from data collection, not sometimes intentionally, but due to lack of awareness on capacity among the WASH practitioners, lack of proper guidance on data disability collection, inadequate design surveys and data collection methodologies. In fact, a lot of issues around that. In fact, the methodologies, how do we even have the question? I think that was mentioned earlier on. Then in most cases, especially from government partners, lack of budget for disability inclusion and accessibilities. So this guidance addresses these challenges and provide practical guidance, examples, and tips for disability inclusion in each of the steps of the monitoring process. Next slide. And for us to do that, we have to consider these basic principles. I think these are principles probably all of us are aware of. We have to carry this along anytime we talk about data programming. The whole purpose, number one, is to remove barriers. We have to ensure persons with disabilities can participate in data collection, monitoring, and reporting by identifying and removing barriers. Often and often, we always assume we can do this on their behalf, which is often giving us not the result we want. So we have to make sure that we engage with persons with disabilities in data collection. Participation is really very important, which provide opportunities for persons with disabilities to participate in all aspects of data collection, monitoring, and reporting. Ethical considerations ensure that all data collection processes are ethical, disability inclusive safeguarding practices are in place. The terminologies are extremely very important. Use positive terminology when working with persons with disabilities and report. The accessibility. Consider the accessibility of processes, information, and reports. So with these principles, we're able to design these guidance, making sure that all these principles are fully addressed. Next slide. I mean, what I've just shown you just some snapshot of why and what the slide about. Of course, we're going to post the guidance note on the chat box so that you can, for those that you can read more about the guidance note. It's extremely very important. It's very rich. It's very practical. For us, UNICEF has been every day helping us to further unpack the issue of data. And for us, we, as part of the key performance indicators, all our report information have to be disaggregated. We want to see the number, the quality of programming that's address the need of persons with disability. So for us, it's extremely very important. So in closing, in terms of recommendations, what we're saying is that we have to design watch programs to be disability inclusive and accessible. I think we cannot stop from reinforcing these messages. I know we've had this several times, but we're going to say it until things improve and not all of us are on the same page, on the same frequency in terms of programming. So we'll not be tired of saying that. We have to establish partnerships with organizations of persons with disabilities. We have to include disability in monitoring frameworks and mechanisms. There is very simple as narrative, but when it comes to reprogramming, these are the issues that actually affect accessibility. So that's why for us, they are extremely very important recommendations. We must have clear definitions and standards for disability inclusive watch depending on your context. More importantly, we must build capacity on disability inclusive data collection, monitoring, and reporting. There are a lot of tools to be used, and there must be synergy and animation of these tools among all sector players so that we use the right tools, we use the right methodology so that we are able to capture the needs of the watch needs of persons with disabilities. That will really help us to plan and address these needs. So data is extremely very important. And as you say, you don't have to be a disability specialist or an expert. All watch actors can contribute to strengthening disability data collection, monitoring, and reporting. I mean, this is what in snapshot, what the guidance note was just trying to talk about. A lot of practical examples were in the guidance note. So I'm going to put that on the chat box for further reference. Next slide, please. So this is just the guidance. As I said, I'm going to post the link there so colleagues can have a look at it. And of course, if we have any question on it, we are here to answer the questions. Next slide. Apart from this guidance note, again, I mean, as you see from this session, we've been working in partnership, working with all the conveners of this session to make sure we improve the accessibility, we improve, we come with common voice, strong voice to raise the voice to advocate for disability inclusive watch programming. So we have other resources. I'm sure time will not permit us to do that. So I'll just show some few other initiatives that are ongoing that, again, they are all aimed at making sure that we have proper mainstream of disability in our watch programming. Next slide. With WaterAid, World Bank, and UNICEF, we are presently working an online course for disability inclusive watch program. This course is being developed based on existing material developed by WaterAid with additional resources from World Bank and UNICEF. And hopefully this online course will be launched sometime in September and be open and accessible to all colleagues to have access to. All these are aimed to further enhance our capacity on disability inclusive watch programming. So just stay tuned. And of course, when the course is ready, we'll communicate to colleagues for them to access it and then probably empower themselves or get more information or training on disability inclusive watch programming. This is just for information, by the way. Next slide. And this is my last slide. Again, so I think sometime last year, the group, this same group, will launch this the watch sector resource page. It's very rich. I mean, just go there, you see a lot of publications, a lot of resources, a lot of tools that were developed by a lot of sector partners. And it's all combined. It's on International Disability Alliance page, but there's a dedicated page for this. So if you go there, you will see a lot of resources, tools, methodologies, reports on disability inclusive watch programming that really help us to have increased knowledge and improve our programming. So I think the information are there, and we're going to talk about it. We're going to see how we enhance our capacity. So let me stop here, and if there are questions, we'll be happy to address the questions. We'll post all this on the link so colleagues can have access to it, and we can only continue to improve on this. And I want to thank you so much. Over to you, Rosario.
Okay. Okay. Thank you so much, BC, and thank you for all your wonderful presentation about the work that UNICEF is doing, and especially about this online course that will be held maybe in September. And thank you also to all our speakers for sharing their professional and personal experience on designing and expanding inclusive WASH. We have heard and learned a lot from our speakers, but now we would like also to hear from you, from the participants. If you have not done so already, please submit your questions and comments in the chat box. We will now have like a few minutes to share reflections and address any questions. And I would like to invite my colleague, Martina, who will be supporting me with some questions in this Q&A session.
Thanks, Rosario. Yes, we have a few questions in the chat box, and the chat box is on the Pathable website, just to make sure that everyone can find it. So it's not the chat box in the actual Zoom meeting, but on the website where you first entered the meeting. So the first question that I would like to read out, Rosario, is from Ylva. She says, where do you see difficulties in getting your knowledge and understanding of inclusive WASH translated into policy and then into action? What are the biggest challenges and constraints from getting this understanding to policy and then to action?
Okay, I don't know if one of our speakers, maybe Jang or other, want to respond this question.
So this is the barriers to getting policymakers to implement your research findings. Is that right? Okay, so I popped an answer in there, but just to flesh that out, I think from my experience, policymakers and service deliverers do want to do inclusive WASH, but often they don't know how. So I think right at the start of research, you need to understand who's what, so map your stakeholders, their roles and responsibilities, their power to implement the recommendations, and target them effectively, and understand what sort of evidence leads to change for that group. So for example, at the district level government, it might be qualitative studies. At the national level, they like big numbers, so that where you get into surveys there, ideally you do both, and then you can speak to both. But I think if the research is rigorous and it involves stakeholders effectively from the start, so you're generating evidence with them, so you interview them and they can see their responses reflected in your findings, and then you collaboratively develop practical solutions to address those issues, so it really speaks to what they want, then I think you can see traction on inclusion. Part of the DFAT funded study in Bangladesh, so that I presented on, WaterAid shared early findings from the research at a national WASH strategy development meeting and planning meeting. And because they had rigorous evidence that backed up their calls, so they were saying it must be inclusive, you must ensure people with disabilities are included in this process, and this is why, they were able to draw on rigorous evidence to really give their calls weight. So that worked. The policymakers listened to them. So that's really important. And a big part is making sure that your research is really rigorous. But I do think making sure that the findings are documented in an accessible way that targets different stakeholders with different products is helpful. I hope that goes some way to answering your question.
Okay, thank you so much. Do we have another question, Martin?
Yes, we do. We have a question which is directed to Aniatike from the Ministry of Health in Tanzania. So Faith Chabede is wondering, or she's saying that the inclusive WASH policy in Tanzania is a really good step in a great direction. But is also wondering if this policy is enforced for private construction of buildings that are not government owned. And there is also a question from Rachel Stevens, which I'm wondering maybe if the same speaker could perhaps include in the answer. And that's Rachel is wondering if there is work also done to actually access the WASH buildings, so the path leading up to, for example, toilet blocks. So there were some good examples of accessible toilet blocks, but she's wondering sort of the road or the path leading up to these blocks, if that's also worked on and made sure to be accessible.
Oh, thank you very much for those two good questions from Faith and Rachel. I'll start with the first one. Once the policy is formulated, it is not meant to be implemented by the government itself. It's both for the government and also for the private individuals. So, for instance, for the schools, the toilets which are now being constructed, the provision of facilities for people with disabilities are for both for public as well as for the private.
Apologies.
Same applies to healthcare facilities because the guidelines, the policy may be enforced by each and every one. Differs is just the scale, able to cover many schools and healthcare facilities, unlike the primary, unlike the private sector, but the policy is for everyone. The question from Rachel regarding accessing the lot, the answer is yes, I can say, because as we have shown, once a person gets to a toilet, we have provided the baristas, which give guidance for someone maybe with a visual impairment so that you can see to accessing the toilets. And also the lamp has been provided. And in schools, we have also constructed some blocks to show the demarcations of a road that leads towards the toilets. That's what we have been able to do. We have not done the sophisticated technologies like in other countries, but just that simple ways of just helping someone to locate where the toilet is. Thank you.
Thank you so much for the response. Is there any other question in the chat box, Martina, or we don't have more questions?
There is not, it's not really a question, but there is a comment from Lindsay Lange saying that she really appreciates the inclusion of considerations for people with intellectual abilities. And I know that's something that Special Olympics have been working a lot with and also in the collaboration with WaterAid. So I was wondering perhaps if there is someone from Special Olympics, maybe Faith, who can just comment on the importance of including people with intellectual disability.
Yes, very important comment. That's why, I mean, that's why it's very important to know also how to include persons with disabilities from different constituencies, because sometimes we only think about persons with physical impairment or sensory impairment, but we don't know much sometimes about persons with psychosocial disabilities or intellectual disabilities. And yes, that's a very important comment. Thank you so much.
Oh, yes.
I don't know if we have some minutes to conclude.
I think Faith from Special Olympics wanted to just comment on that.
Okay.
Before we wrap up.
Okay. Thank you.
Yes, and thank you, Martina, and thank you, everyone. I think it is important to note that people have diverse disabilities, and in addressing the needs of people with disabilities shouldn't be just a matter of making structural changes, but also to think of all barriers, including information barrier that would often affect people with intellectual disabilities. From the video that we saw, we learned that in most cases, it's just assumed that when facilities are in place and the ramps are in place, everyone can be able to know that this is their facility and this is how they can use it. Whereas for people with intellectual disabilities, it can go more, can go beyond that into also educating them on how to use their particular facility that is put in place, and also include signage that is not limited to reading only, but also in the form of pictures or diagrams that can that people with intellectual disabilities can be able to identify. And my comment also for this forum is maybe if WASH players can be able to come up with signage that could be universal, that is known that this is when a person sees a sign like this, they know that it means a toilet, it means a hand washing facility, so that even those with intellectual disabilities can be taught and know how to use those the signs and be able to interpret them. So yeah, thank you so much, and I thank for all the presenters for including everyone, including those with intellectual disabilities.
Okay, thank you so much. If we don't have any other comments from other speakers, I mean, I don't know. I would like to thank first all our partners for this event: WaterAid, World Bank Group, UNICEF, Swedish International Development Cooperation Agency, Special Olympics, HelpAge, and International Disability Alliance. And I would like to say that definitely there's a lot of to do in order to do this, especially to fulfill this goal, how to institutionalize disability inclusive watch and move from one-time interventions to sustainable inclusive programs at scale. I think we need to recall that we need to link this with all the principles that are in most of the treaty bodies, especially in the Convention on the Rights of Persons with Disabilities, such as non-discrimination, equality of opportunities, and also self-respect and autonomy. And just to mention that this is very important also to highlight that we need to do all our efforts to make a reality this overarching principle of the 2030 agenda about leave no one behind, because definitely it's in the SDG 6, we have everything about water, sanitation, and hygiene. And thank you so much again to all the speakers. We will be also disseminating soon about this course that BC mentioned about inclusive disability watch programming. Thank you so much, and thanks to all the organizers for inviting me to moderate this fantastic event. Thank you so much.
Thank you. Very well done. Thank you.
Thank
So
you,
informative.
everyone.
Very well done. Nice. Thank you.
So much.
Thank you. It's great.
Thank you, Rodalia.
Thanks, everyone.
Thank you.
Bye.